Hi friends, Dr. Nancy Trimbley, putting the power and knowledge of your health back in your hands. I get frustrated sometimes because it is our habit to take x-rays of patients when they first start care with us. And I am looking for a number of different things, obviously, but one of the things we do see on those spinal x-rays is arthritis. Now, arthritis is a pretty big catch-all term. There is, I've heard 100 different types of arthritis, ranging from things that are autoimmune disorders to skin and bone disorders, lots of different things. But what we're talking about here is osteoarthritis. That is arthritis of the joints. Osteoarthritis happens from one thing: trauma to the joint. That's it. The trauma could have been 10 years ago, could have been 50 years ago. Trauma to the joint causes joint disruption, and then two things happen. Arthritis, osteoarthritis, is just two things. The space, the joint space, gets smaller, and there are bone spurs. So here I have a lumbar model. This is the lumbar spine, two vertebrae, and this is a normal one. And you can see the space, and you can see the bones are fairly smooth in contour. This is normal. Now let's compare it to this one, which is showing arthritis of the spine. And you can see that the space between the bones is more narrow, and there are these juts of bone here. That's bone spurs. That's all arthritis is those two things. Now here's where it gets really complicated, and here's where the frustration comes in. Joint arthritis can be called a variety of things. It can be called disc degeneration. That means that this part of the joint, the disc in between the vertebrae, is degenerating. It can be called degenerative disc disease. It can be called degenerative joint disease because the joints in the back of the spine also can get bone spurs and smaller joint spaces. It can also be called spondylitis. Spondylitis is a Latin term for arthritis. There is so many different terms for arthritis. And I'll say to a patient, oh, you have disc degeneration. And they'll say, oh, wow, not good. And I say, yeah, it's from an old injury. And then about a month later, they'll come in and they say, I saw my medical doctor. He said I have arthritis. You didn't say I have arthritis. I'm like, okay, yeah, I did. But I used a different word for it, a more complex word or phrasing. So just so you're aware, there's a lot of terms thrown around for arthritis. And when we're talking about two things: decreased joint space and bone spurs. And it is from old injuries. So chiropractic helps tremendously with arthritis, not only to decrease pain, but improve mobility and flexibility, and also to improve the joint itself. So putting the power and knowledge of your health back in your hands. Bye for now.